Let's see what it's like to get a calcium score screening. If you are over the age of 40, you should consider getting a calcium score screening so that you can better understand your risk of heart disease. Additionally, those that are at increased risk for heart disease should particularly consider getting screened. Those individuals include having a family history of premature heart disease, if you've ever been or continue to be a smoker, if you have high cholesterol, if you have high blood pressure or are overweight, or if you're quite inactive. The more risk factors you have, the higher the risk you are for developing heart disease, and the higher the risk you are, the more you might want to consider getting screened. The most utility that you and your doctor can get out of having a calcium score is if your risk of having a heart problem is what's referred to as moderately elevated. For example, you're over the age of 40 and perhaps you smoke cigarettes, or perhaps you have diabetes, or perhaps you're 40 or maybe even younger, but you have a profound, strong family history of heart disease in parents, grandparents, brothers, sisters, cousins, whatever, at a premature or young age. Those are all indications to consider having a coronary calcium score. But in general, if you're moderate risk and the calcium score is extremely low, or better yet, 0, that moves you to a lower risk category, whereas if you're moderate risk and the calcium score is greater than 0, especially if it's very high, that will move you to a higher risk category and change how aggressive you and your doctor both want to be with respect to how they treat your lifestyle and your risk factors. Check out this calcium score experience so you know exactly what to expect during your screening. The first step is meeting with your cardiovascular specialist or general physician who will order the test and discuss with you whether you should have the test. If you are unsure whether you qualify to have a calcium score, it's important to meet with your physician and discuss what is involved and whether you should have the test to help you and your physician make a decision. The second step is the screening preparation. It's time to consider the preparation, and the preparation is fairly easy. One day prior to the scan, you might consider avoiding caffeine and smoking so that your heart rate is as slow as it can be during the test. When you arrive for your screening, you will be greeted by the front-end staff. When it is your turn, you will be called out of the waiting room by the technician. You will be guided onto a scanning table where you will lie flat on your back with your hands above your head. The technician will clean 3 areas on your chest, attach sticky panels that are connected to an electrocardiogram machine, EKG or ECG for short, and this will be used to monitor your heart during the scan. The table will then slowly be moved into the middle of the donut-shaped machine or the CAT scanner. The donut-shaped machine is a computed tomographic scanning machine, also known as a CT or CAT scan. It's used to capture the detailed internal images of the body by using a combination of X-ray beams and a computer. In this case, the scan will be synchronized with the EKG to look for the presence of any calcium in your heart. If calcium is present in your heart, the computer will create an actual calcium score that estimates the extent of coronary artery disease. Coronary artery disease is the narrowing of arteries that supply the heart with blood, due mainly to the buildup of plaque. There are multiple types of plaque, but what the calcium score is looking for specifically is calcified coronary plaque. Once the scan is completed, you are free to change back into your normal clothes and head home. And when you see your doctor will discuss the results of your calcium score with you and come up with a game plan for what comes next.